Good afternoon, everyone. Thanks for hanging in here for the last panel. You always kind of wonder if you're last, how many people are going to hang tough, so thank you all. I'm Helen Young-Hayes, and I'm the founder and CEO of Activate Workforce Solutions. I am, first of all, an investor. I began my career 30-plus years ago on Wall Street, and I was the portfolio manager of the global and the international assets at Janus Capital. So although the portfolios that I managed were very large, my investment style was bottom-up. I invested in companies one by one in the Peter Lynch style of management. So one by one and company by company, and I loved the thrill of analyzing each company as a dynamic organism that was unique and that changed with time. And so my favorite part about being an investor was spotting potential before anyone else did. I'm also a philanthropist. For 25 plus years, my husband and I have been donors mostly in the field of poverty alleviation. So fighting poverty has been my passion for over 25 years. And for us, that has encompassed everything from basic necessities, food, clothing, shelter, transportation, to education access, as well as social intervention. And yet, as a 25-plus year philanthropist, the one thing about poverty alleviation that has left me most frustrated is the intractability of poverty. So for many of our individuals who are impoverished, there is no pathway out. And it was that reality that led me to decide that as a donor I needed to add to my portfolio and add work. For me, work stands alone in its ability to end poverty. And I decided that I was going to investigate and explore and analyze the workforce development space. That journey took me on an analysis of workforce development participants, not only locally here in Colorado, but also nationally. And in my exploration, I discovered that there are many sectors of workforce development that are working really, really well. And we saw a couple of exciting examples today. However, there are also many sectors that operate in silos. And there are gaps in the workforce development system. And as I analyzed who was doing what and what was going well, I decided that I wanted to step in Colorado and fill some of the gaps that exist in the workforce development system. We have a number of successful nonprofits and government agencies that are providing work experience training and skills to low-income individuals. And so we have an ecosystem of nonprofits and government that are working hard to impart skills to individuals. On the other hand, we have business. And we have business that provides those all-important jobs without which we can't end the cycle of poverty. We have employers on the one hand who are crying out for good workers. The labor shortage has been talked about, the skills shortage has been talked about. The complaint to me that I hear from employers, I can't find good workers. And on the other hand, we have those individuals who not only need a job, but who want a job, who not only want a job, but who are skilled for a job and eager to find satisfying work. And their mantra, their complaint to us is, I can't find a good job. So Activate Workforce Solutions provides a business solution to a social problem. We are a human-centered workforce advisory group. And for our employers who are the customers, we provide recruitment, assessment, and placement services. We utilize a large pipeline of talent. And so in the Denver community, we work with over a dozen nonprofits that train and skill up over 1,000 individuals a year. And from those nonprofit partners, we are referred individuals who are career ready and job ready and who lack that pathway to employment. And so we're a connector. We connect nonprofits with for-profits. We connect potential employees with employers. And in our assessment, screening, vetting, and endorsement, we provide an important thing for employers and for the employees. We provide the vetting and endorsement that says this individual has the skills necessary to succeed in your job. And so we vet and screen rigorously. We are looking at an individual's talents, skill sets, soft skills, hard skills, middle skills, attitudes towards work. And we place them into their dream job. We place them into the culture of the workforce. We place them into the specific job with the specific skills required. And we place them into the commute that works for their family. We place them into real live jobs. And then we coach them. Our secret sauce is in our coaching. We coach them to those important professional development skills that we've talked about already today. And we coach them past the speed bumps that typically will derail people coming out of poverty. So we'll coach them past the cliff effect, because when they make 50 cents more an hour, they might lose their food stamps or they might lose their benefits, and we help them navigate that journey. Our retention rates for our employers have been between 2 and 3 times the retention rates in their average employees. And so we are placing individuals who are succeeding, and we're saving our employers money. So we're a fee-based service. Our employers pay us for our services, and we are the connective tissue between disconnected parts of the workforce development spectrum. My passion today and why I'm excited about exploring the topic with you all is, as a philanthropist, I'm always looking for more and more effective ways to measure the outcomes of the organizations and programs that I'm investing in. And as a workforce development individual, former Wall Street executive, I'm passionately interested about finding the potential and spotting the potential in individuals when it is massive, and yet it is often unrecognized. And so I'm still in the business of spotting potential. It's just in the human capital form. So with that, I will ask Dave to introduce himself. Dave Anderson is the Director of Evidence-Based Policy at the Laura and John Arnold Foundation, which works to develop and support initiatives that encourage governments and nonprofit organizations to help build the evidence base for social interventions and to consider reliable evidence as one of the primary factors in their decisions. So Dave, would you introduce your work to us, please?
Sure. So I'll talk mostly about the work that our team within the foundation does, the evidence-based policy team, but I think you gave a good overview of our foundation's philosophy, that the effective generation and use of evidence about what works is really central to our mission. And we think that's a critical piece of making progress against a lot of longstanding social problems. And so our team tries to tackle this in a couple main ways. The first one, we think there's a critical need to grow the number of programs that are backed by strong evidence of effectiveness that policymakers and practitioners can choose from. And so when we talk about that, when we say strong evidence of effectiveness, we're setting a pretty high bar there. We're talking about programs that have been shown in well-conducted, randomized controlled trials to produce sizable, sustained effects on important outcomes like earnings, employment, not just intermediate outcomes like, did they sign up for a job training program, that's useful to know, but it doesn't necessarily guarantee that at the end of the day they're going to end up in a better place, better jobs, better earnings. And so we fund a lot of randomized controlled trials. That's how we're trying to grow that body of programs backed by strong evidence of effectiveness. And we do so across all areas of social policy. We fund a lot in the post-secondary education space, also in the workforce development space. And when we're looking at a proposal for a randomized controlled trial, the first question we really ask is there a compelling reason to evaluate the program that's being proposed? And there's a couple of ways we think about that question, what's compelling. But the main one is there a signal from some prior evidence that if we go forward with this randomized trial, there's a decent chance that at the end of the study we're going to find something that improves people's lives in a meaningful way, that it moves the needle on an important outcome. And so the reason that we draw on that prior evidence, and that prior evidence could come from other randomized controlled trials, it could come from a lot of other different types of research, less rigorous studies, comparison group studies that don't necessarily randomly assign people to program or control groups, but still provide valuable information and hints about what might work, or even really strong evidence from studies that look at people before and after a program, where you don't have a comparison or control group, but you see a lot of growth. That could be suggestive of something that could work. But we want to draw on that evidence from prior evaluations, because the history of rigorous evaluation in all areas where it's been done, where randomized trials have been conducted in medicine, business, social policy, psychology, the general lesson is that most things that we try to address any given challenging problem turn out not to work. They have weak or no effects. And if you think about it, we really shouldn't be that surprised about it. And you just mentioned poverty it's an intractable, difficult problem. So for any given program that we're rolling out there, the odds of that being the silver bullet to solving poverty is pretty slim. So a lot of things we try don't work. And so we're trying to maximize the likelihood that when we do these studies, we're going to find those holy grail programs that really improve people's lives in a meaningful way. And we think by drawing on the signals from that prior evidence, we can help ourselves do that. The other piece of sort of this evidence building and use that we do at the foundation and within our team specifically is we try to create incentives for jurisdictions to adopt and faithfully implement programs that have already gone through this evidence building process. They already have strong evidence of effectiveness. They've been shown in well-conducted trials to produce sizable sustained effects on important outcomes. And what we do through our Moving the Needle RFP is we ask jurisdictions to come up with funding for the program services. So it could be from another foundation, it could be using federal or state funds to target that at a program that already has this strong evidence. And then we provide funding, technical assistance grants, to make sure that the program that they're implementing on the ground is actually the program that was found to be effective in the prior research. What you often see in the field is people will say, all right, I'm going to do the evidence-based PERSCOLAS program. So PERSCOLAS, sectoral employment program, teaches folks who are underemployed how to fix computers, how to do basic IT troubleshooting, great connections with employers, so it helps them get placed in jobs. It's been shown in 2 well-conducted randomized trials to produce sizable effects on earnings over a 2-year follow-up period. So we want to see that in wider spread use. But we want to also make sure that if somebody goes out and says they're doing the PERSCOLAS program, they're actually doing the PERSCOLAS program. They're not doing some watered-down version of it where there's less training, or they're not covering the same topics that were shown to be effective, or they don't have connections with employers, so maybe they train these people up, but then they just throw them out into the job market and wish them luck, but they don't have as much success landing in real good jobs. So those are the 2 main pieces that we're trying to tackle in this evidence building, evidence use space. Is first, grow the menu of options that practitioners and policymakers can choose from, and then create incentives for people to adopt those programs and implement them faithfully. And we think if we do those 2 things, we could start seeing a lot of progress against a lot of long-standing problems. And then just one last piece, more broadly within the foundation, some of the other teams that we work closely with put a lot of emphasis on trying to increase access to data for researchers to do more studies using the great administrative data that's available both in public systems and private systems, so that we can start answering policy questions using that administrative data. So that's integrating data systems within state government, so you can find out people's educational outcomes and their employment outcomes. You don't have to just wonder, and also creating systems for secure access for researchers to that kind of data to make sure that if they can use it, they can answer important questions, but they're also protecting the privacy of the people whose data is represented there. So that's sort of a big picture overview of, I think, our work in this area. I'll stop there.
Great. Well, I'd also like to introduce to you this afternoon Gabe Hakim, who is the COO of Generation USA. Generation USA was born out of the McKinsey Social Initiative. They are building a skills training methodology that can serve hundreds of thousands and eventually millions of young people a year through pathways to employment, as well as supported coaching services around that. Gabe, can you tell us a little bit about yourself and what you're doing?
Sure. Thank you, and thank you everybody for having us here today. I'm thrilled to be representing Generation USA. I'm Gabe Hakeem. As Helen said, I'm the COO of our USA organization. But Generation is a global organization that was really spawned out of the McKinsey Social Initiative in 2014, and I'll probably start our story there, which was in 2014, still on the heels of the great global recession. McKinsey did a large sort of global survey of sort of the education to employment workspace and the workforce development space, and found collectively around the world that there was, as has been talked a lot about today, a mismatch in demand for high quality employees and demand for high quality jobs and a supply of high quality employees. And as we've seen globally, and we're focused here in the US, I think as of 2013 or 14, there were some 6 million youth between the ages of 18 and 29 in the US who are basically disconnected. They're not in school and they're not working, and probably an equal amount who are underemployed. And so looking at this, McKinsey said, what is the issue with trying to connect people who really want to work with these jobs that are available, but employers can't really seem to find the right employees for them. And so a unique thing happened. A very senior partner at McKinsey, Mona Morshed, who championed a lot of the research on this work, said, this is a unique opportunity for McKinsey to sort of put its money where its mouth is in a way that we haven't traditionally done in social impact work in the past. As you know, McKinsey is a global consultancy that largely serves for-profit, nonprofit, and government customers in solving challenging management problems. We also do a lot of pro bono work around the world, but it's always sort of been office-based and over 100 offices around the world and not really coordinated. And so out of this report, Mona had the idea that we should launch our first coordinated social impact effort across the globe, and that was what the McKinsey Social Initiative was born out of. And from the McKinsey Social Initiative, Generation was the first initiative within that to try to address a big issue globally in a way that we thought McKinsey was particularly well positioned to help with. And what we knew is that, and what we saw in conversations with a lot of the clients that we served, is that this wasn't just something that would bring a quote unquote benefit to society, but was something that ultimately was an issue a lot of our clients were seeing as well. And having the skill sets and the experience within McKinsey globally that are required for a lot of good workforce development programs, we thought it would be a good opportunity for us to try our hand at it. That was 2.5 years ago. Fast forward to today, Generation launched as a global organization in 5 countries, the US being 1, Kenya, Spain, Mexico, and India are the other 4, and we're actively growing. Across the globe in the last 2.5 years, we've trained and graduated, I think, just over 14,000 students, and about 10% of those have been here in the US across 10 cities where we have programming. Generation is now its own nonprofit, distinct from McKinsey or the McKinsey Social Initiative, although McKinsey has, over the first few years, and will continue to invest, largely at this point through talent and technical investments, upwards near $70 million into Generation. And the goal is really twofold with Generation, both globally and specifically in the US, which is to do 2 things that we thought through this report haven't been achieved in the workforce space to date, but need to be in order to address a much larger, that much larger, at least in the US, 6 million person population that is, without access, youth that are without access to a good job opportunity. And the first one is to create a program that at its core is scalable and replicable, which at the end of the day comes down to the ability to create a model that is efficient enough in its recruiting, in its training time span, in its human capital investments, that it can be, ultimately sustainable in a relatively short period of time and continue to produce results on a regular basis. So the scalability was one component. The other thing that we've really strived for and continue to push for that we think distinguishes our programs at Generation is to create a demonstrable return on investment for our, we say we serve two servants, so for our two primary stakeholders. I think as was highlighted really well throughout the day today, one of those stakeholders is traditionally thought of as being the students that we serve, and for them we definitely track and think about the improved life outcomes that we're able to provide for them, most specifically starting with placement in a job and then retention in that job, and tracks for upward mobility. But similar to, I think, the thread that's gone through this conversation throughout the day, we really start with a return on investment for our employer partners, mostly because one of the things that we saw in evaluating other programs is that the best place to start in any jobs program is a place where there are jobs for someone to fill. And so that's what we think is really unique. I think other programs do this, but one thing we really focus on intently and design everything we do around in Generation, which is that we start with employer partners and pre-confirmed job vacancies before we even consider launching a program in any of our particular cities or in an industry. Once we have those pre-confirmed job vacancies, we have a team, our curricular team, that goes in and will design the curriculum specifically for those industries and those specific jobs around what we like to call, around things that will create a return on investment and create value for these specific employers that we're working with. So we start by saying, what are the things that your, in this case, entry-level employees do that drive actual value? What do your best employees in these positions look like? And what are the break points that happen where value is lost when they either don't do their job well or you aren't able to, retain or attract that talent in the first place and suffer from chronic turnover or open job positions. Using that, we focus our curriculum, very specifically, not just on technical skills, but also on what has been described here as soft skills. We call them sort of mindset and behavioral training, and that is in order to drive that ROI for our employer partners. We've found that, in most circumstances, for instance, talk about the IT, sort of like an IT program, which is one of the ones that we have, while the technical competency is also often what is needed in for an IT job, you'll find that the areas where things break down for employers and their employees is when, they don't have good customer service skills. And so we build into the curriculum, about 70% of our curriculum is sort of interactive and sort of project-based in a way that helps train each of our participants for these breakpoints. And then, both during the program in its building and then afterwards, after the program has been launched and graduates have been placed, we work with employers to measure their ROI to our program, with the premise being that, ultimately we see our path for scalability being that employers fully pay for Generation services, and then Generation will help them get more than $1 out of the dollar that they invest in what we do. So I'll pause there, but I think that's probably a good overview. I think, I guess the last thing I'll close on is that, we're a young organization, so we are, but, with our McKinsey DNA, we are sort of fiercely data-driven, and I think we've done a good job in both trying to figure out as much data as we can collect along the way, and I think we'll talk in a little bit about some of the obstacles that come with that. In terms of our outcomes to date, we think we've been successful and are pushing to be more successful, but we've seen about 80% of our program participants graduate from our 4 to 12-week boot camps. About 85% of them have found placement in a job within 60 days, and about 85% of them retain that job, are retained in their job 6 months from then. So we're proud of those results, but of course, we're looking to continue to improve those.
Great, thank you, Gabe. Today we are going to discuss, oh, yeah?
I missed, where are you recruiting these people from?
Me? Oh.
Where are we recruiting our program participants from? Generally in the communities that we work, we have community partners. It could be the United Way, workforce investment boards, yeah.
So today we're going to explore some of the major challenges in evaluating what a good jobs program is. But before we dive into what a good jobs program is, I would like to ask our panel to define for us what a good job is. What is a good job? Dave.
It's a good question. I think, you know, when we look at this from sort of an evaluation perspective, we're looking, I think, for programs that move people into jobs that meaningfully improve their socioeconomic status, provide them with stability. Ideally, it's not a sort of a transient job. It's a job that's there for a while and potentially has room for growth, so that they can sort of, you know, see it not just a job, but go into a career, and, you know, basically have something that people are invested in. I think that's the ideal that you're shooting for. I'll also say that depending on the program and the particular population you're serving, that also plays into the type of job that's realistic as the first job. So we look at that when we're funding evaluations too. You know, you're not necessarily going to jump somebody who's been out of a job for 5 years directly into a really high-paying one, and so you're trying to figure out the pathway that they can take to a meaningful career.
Yeah, I think the point about, you know, for a jobs program, it depends on the folks that you're starting with and where they're coming from and where you're trying to take them to. I think for us, a good job is defined in the context of the two primary constituents we work with. So for our program participants, most of them are coming in either unemployed or underemployed. So getting them into sort of a stable full-time position that we strive to, you know, get a living wage depending on the city that they're in, which is ideally above usually the minimum wage, obviously, in the cities that we're working with them in. So, you know, a stable job that pays better than what they're currently in, if they have one, is one important metric for our participants. We also do work to measure sort of their life satisfaction and other life outcomes outside of, you know, the initial placement into the job and the wage that it pays, because I think, like all of us, you know, your job should be something that also brings you some level of you know, purpose or satisfaction if possible, and that, as we know, drives retention into those jobs in the long run. But I'd also say a good job on the employer end is one that drives value for the companies, and I think that's one of the things that we really focus on a lot too. Is, you know, a jobs program in its abstract often can prepare folks for, you know, an abstract job, and I think that a good job is one for which an employer has a need to fill it, and you know, really values the work that the people coming into that position can do. And you know, I think we've seen that, you know, really the sweet spot is where those two match up.
Right, and I will add that from our perspective, we think of a good job as full-time, not part-time, unless the participant wants part-time work for whatever reasons, self-sustainable wages. And so we look very much at the affordability of a market and how the jobs can help them be self-sustaining. So interestingly, 21% of the jobs, full-time jobs in Colorado, are not high-paying enough for the individuals to live without government benefits. And so we look at self-sustainability. We are very much focused on dignity in work, and our mission is economic freedom through the dignity of work. And so we place with employers who provide career pathways or who have institutionalized career pathways like apprenticeship programs. And so I'm not satisfied with poverty alleviation. I don't want to help my candidates sidestep poverty here and there and dodge a boulder here, but I'm really satisfied when we get to the wealth creation phase. And so we look at the whole balance sheet. We look at debt, we look at lifestyle, we look at savings and earnings, and some of those intangible measures of job satisfaction. So great, that's how we'll maybe agree to define what is a good job. Let's actually talk about jobs programs, because someone asked me yesterday, what is a job program? And that can mean many different things depending upon whether you're in economic development, whether you are an employer, whether you are a nonprofit. So Gabe, we'll start with you. Define a good jobs program. Define a jobs program.
I would say, at least in our context, a jobs program is one that recruits, trains, and places, desiring participants into a job that is available at an employer who is seeking to fill either a specific or a set of specific positions. And I think the components that you just touched on in terms of what is a good job should be components of any program that is trying to make that match happen.
Well, I mean, I guess we don't always think about it in terms of defining the program itself. We're really, when we're funding studies and funding scale-up of evidence-based programs, we're really sort of fixated on the outcome. So we don't get sort of set on a particular program type that we're looking to fund. So we fund across a lot of different sectors. We're funding a big scale-up of career academies in California. So those are technical high schools that provide vocational education. Same thing, we're evaluating. New York City has a big CTE program in their high schools. We're doing an evaluation of that. We're doing a lot of funding in community college settings. So there's a big crisis in terms of community college completion. A lot of times it's less than 20% of people who start at a community college end up getting all the way through. And so identifying ways within the community college system to provide the supports financially, emotionally, and just sort of strategically for people to actually make it all the way through to get a degree so that then they can qualify for jobs that they wouldn't otherwise be able to qualify for. And then working in the workforce space, we do a lot of work with the kind of programs that we've been talking about here today, sort of sectoral employment programs where there's a clear tie between the training program and the skills it's providing and what the employers are looking for in their workforce. So we're funding a number of evaluations in that space as well, trying to identify some more effective sectoral programs.
More and more philanthropists and foundations look to include evidence-based data in their analysis. More and more nonprofits are reporting lots of data. And so we start with you, Dave. Can you help us understand how we determine what data is irrelevant in the work space that you have seen, and what constitutes maybe bad data as opposed to good, rich data?
Okay. I think it depends a lot on where a program is in its development. I think the point that you were making earlier about how you've set this up to be a replicable model where the program is well defined, and so you can be confident that when you go out to a new city that you're going to implement it as intended. I think what we see a lot of times is people try to jump from a good idea about a program and try to go straight to sort of the most rigorous evaluation that you can do. You can do a randomized controlled trial. But what they really need to be doing is sort of generating data about what their program is, some basic implementation data. If you put this out into the field, are people showing up? Do they find it useful? Do they seem to be learning the skills that they're supposed to be learning? And so at that early stage, that's very useful data, right? But as a program develops and it gets more and more of a promising evidence base, maybe through before and after studies, some initial comparison group studies, and it's looking to scale up to a large degree where a lot of people are affected by the program, a lot of resources are going towards it, that's where we suggest that you need to get to that sort of more rigorous end of the evaluation spectrum to really be confident that the program itself is driving impacts. And so that gets back to sort of the outcomes that we focus on when we're looking to fund studies. It's useful to know, and especially in those early stages, to know, is this program increasing the likelihood that people sign up for job training or that their attitudes towards getting a job improve? But those aren't very predictive in the long run of how well they're going to do in the workforce. And so when you get to that final, most rigorous end of the evaluation spectrum, you really want to know, is this program relative to other services in the community, is this program improving people's employment rates in a meaningful way, their earnings in a meaningful way, the wages of the jobs that they're getting in a meaningful way, and then measure that over a sustained period of time. A lot of times what a pitfall with a lot of studies, randomized and non-randomized, is the follow-up is too short. You know, you might see a big uptick in somebody's outcomes 6 months or a year after a program, but a lot of times the control group catches right back up, or the treatment group sort of falls off a cliff, and so 2 years later they're at the same place. And you need to know that, because if you're investing a lot of money into this job training program, the bottom line in that case is that after 2 years, you haven't meaningfully improved that person's life relative to what else is available in the community. So that's why we need to see sort of sustained follow-ups on these important outcomes.
Can both of you address the difficulties and challenges of tracking data? Longitudinal data with low-income individuals can be very difficult. So some of the challenges that you have encountered in tracking data.
Kick off. I mean, Generation is 2.5 years old, so we haven't done anything longitudinal yet. But I think that, I think you hit the point. There's challenges tracking data within the program while it's happening, to say nothing of the fact of, the challenges that come after the program's over. We at Generation tend to over-index on collecting as much as we can as soon as we can, and then have invested a lot. Our basic program team in any program involves a program coordinator who's sort of like the local CEO of the program, the instructor who provides the program material, and then a mentor whose job is to provide social services and support and help collect and track a lot of the student data both within the program and afterward. So within the program, even keeping things like, and I know that like you were saying, these are some like early indicators, but keeping track of things like attendance and obstacles to transportation or to childcare and other life barriers, keeping track of the number of job applications submitted, and all of these things are things that we sort of track along the way. But once a student graduates from one of our boot camps, we move into sort of job attainment and retention mode, and we invest a lot of time, calling, emailing, text messaging, Slack messaging. We have an iPhone app that we app message folks, trying to get immediate contact right after the program ends to help the participant, develop a plan. What am I going to do on my first day of work? What's, my backup plan if transportation goes wrong, if childcare goes wrong? So there's obviously the support side of it, but then also documenting the data that we collect along the way about, who's the supervisor, 15, 30 days out, are you still in that same job? How's the job going? And we track on both ends. We track both with the participants themselves, and then we try to follow up as much as possible with employers, and get information about the wages of the participant, whether or not they've seen promotions, if they are higher, what level of performer they are. In most cases they are hopefully highest performing among their peers. But all of that, in our experience, none of that ever comes across easy. And it's not just the participants who may have changing phone numbers or email addresses or physical addresses, but in a lot of the sort of middle-skilled, early entry jobs that we train for, employers, managers are changing all of the time. There's not great employer contact information. So we joke inside of Generation, but we sort of train our mentors and our program coordinators to basically be bird dogs of this information, because it's very hard, to have it sustain over a long period of time, let alone a short period once the participant has graduated. And we stay on them. Every week we're sending out sort of a national list of, here are all of our participants in the last 2 years for whom we haven't had a check-in in the last 30 days. Can we follow up with them? And people work through their call lists. So it's hard work, and I think that there's, at least in our experience so far, no silver bullet beyond persistence.
Yeah, I think that's our experience too in funding evaluations, especially when you're trying to measure these outcomes through surveys or interviews or that. It really just takes like really detailed systems and a lot of follow-up over and over again to track down these folks. One thing that I'd mentioned, one of the RFPs that we put out, we're actually expecting letters of interest in later this week, is for low-cost randomized control trials. And what makes these trials low cost is that, or one of the main things that makes them low cost, is that all outcomes being measured as part of the studies are collected through administrative data that are already being collected for other purposes. So in the workforce space, that could be unemployment insurance records within the states. Increasingly, you can get access to census and IRS data at federal, so if you're working on a study across multiple states, that's usually an easier way to go. And that has the benefit of you don't have to go through that really time, resource, and resource-intensive effort to track every individual person down. It's already in a database, it's being collected for other purposes. And so by doing that, you can dramatically bring down the cost of a study from potentially millions of dollars if you're trying to survey a few thousand people to maybe $150,000. And it has the added benefit from a study validity standpoint that you don't lose a bunch of your sample, because inevitably, and I'm sure this has been your experience, you can't find everybody, right? So especially when you start getting into those longitudinal studies where you're looking 4 or 5 years down the road, you start losing 25, 30, 35, 40% of the people. But if you're using administrative data, they're still all in there.
I would just add one thing I would add to that I think we found interesting in this space, and I I would be interested if either of you would confirm this, but there's certain, when you're dealing with data from educational institutions or government programs, a lot of times, there's a substantial sample size that you can, draw conclusions from, statistically significant conclusions from. One of the things that we found in the last 3 years as we entered the space is that, and I'm sure is familiar to you all as well, like the actual job training program outside of an educational institution environment is an extremely fragmented environment. Our goal to get to scale is one that we have hypotheses on, but definitely haven't cracked yet. And I would argue not a lot of organizations have cracked, even to the level that you suggested, Helen, with your organization of being in the thousands of people or students that they serve. So I think that if you're evaluating a program, coming in and expecting sort of what you can get from, I think the stage and the size of the program matters a ton, and we just happen to be in a space where at least the size across the landscape is going to be relatively small and fragmented. And so I think expecting sort of an RCT or something like that is going to be a long way off for a lot of organizations.
Yeah, just to answer that really quickly, the most frequent advice that we give to people who apply to us for funding for a randomized controlled trial is you're not ready to do a randomized controlled trial, so don't do it yet. Either your program's not well enough developed, so you're still working out the kinks there. Maybe you've thought it through, but you haven't field tested it yet, so there's some implementation challenges that could fall through. Or you just haven't done sort of the initial stage research, tracking, performance metrics, some initial outcomes, maybe a comparison group. Once you've got all that in place, that's when you've got sort of the sufficient promising prior evidence and you're looking to scale up in a big way. That's when we would say, yeah, now you need to sort of try to figure out how could you do a randomized controlled trial, and maybe there are some databases that you could tap into to answer those questions. But that's absolutely true. It completely depends on the stage of the program, where they fall in sort of this evaluation spectrum.
So before we turn it over to the audience for questions, I'd like to ask you to each give us 2 pieces of advice for how we can better evaluate any size programs that are jobs programs. So we'll start with Gabe, a practitioner.
This one's simple, but I would say, placement rates and jobs. There's a lot of indicators that lead up to that, but at the end of the day, if the objective is to get someone employed, make sure you have that information. And then I think to the extent that the program is situated for this, take the demand side into account too, which is at some level of a return on investment that is possible for the employers with whom these students are being placed. I know, like right now, we're working on a sort of automated return on investment calculator for employers, and I think that being able to quantify the value that somebody can bring to the job that they're coming to is also a good metric for an organization to be thinking about.
Okay.
I guess, yeah, a couple things. I think the first thing is to sort of signal to grantees that you value this data tracking and this evidence building, because that's really the only way that it's going to happen within a grantee, if they also value it too. You know, if it's just sort of, you know, it's in the atmosphere that people should be measuring data. If they don't see that as useful, they're not going to measure it well, and they're not going to use it in their day-to-day operations. And I think a useful role that foundations can play with grantees is help them realistically situate themselves on this evidence building continuum. You know, where are you in the process of building evidence and generating data, and figure out what's your next step. So don't, like I said, don't jump from the I've got a great idea to I'm going to do a randomized controlled trial tomorrow. It's I've got a great idea, I'm going to develop this intervention, really, you know, refine it, make sure that it's a replicable, something I can replicate in a lot of different settings, then field test it, then do the initial evaluation work. But basically help these grantees figure out where they are in that process so they can figure out what their next step is. Because I think a lot of what's intimidating to programs in the field is just knowing what they're supposed to do next. They hear randomized controlled trials all the time, and so I think there's this, you know, tendency to try to jump to, you know, 10 steps ahead, when really it's sort of a step-by-step process to get there, and sort of realistically, you know, helping them figure out where they should be on that spectrum.
What would be your two?
Well, first of all, as a direct service provider, I am very intimidated when I hear Dave speak about randomized control trials, et cetera. So I appreciate your having space for all of us. But I guess the two pieces of advice that I would give the philanthropists in the room when you're evaluating jobs-based programs is, one, I would disagree that job placement is the metric, but I would say that job retention is the metric, because if we want them to get a job, we actually want them to keep the job and to succeed in the job. So I'm going to add job retention to your comment, and our target is job retention of 80+% in the workforce for 12 months. And we hope to be able to gather longitudinal data with the closeness of our relationships. And secondly, I think that one of the very important factors to look at as donors is the cost to succeed. So if you define success as someone who is retained in the workforce, or you define success as someone who's placed and retained 6 months later, what did it cost all in for the organization to deliver that one success? And so cost to success is very important. We cannot just simply evaluate results, but we have to look at how expensive it was to get to those results.